my name's Paula Hagel. I'm an exercise physiologist at Good Shepherd's Cardiopulmonary Rehab, and today we're going to be talking about heart-healthy nutrition. And our goals and objectives really today are to talk about the DASH diet and how to lower blood pressure and help heart health and overall nutrition. And it is just a general eating plan, and we do have dietitians right down the hall from us if you'd like to sit down with a registered dietitian. But today we're just going to talk about basic heart health nutrition. And research continues to show a powerful link between what we choose to eat and our heart health and overall health. So our diets can manage our cholesterol, our lipids, and our blood pressure, our blood glucose level, and our ability to achieve and maintain a healthy weight. We're going to focus quite a bit of time today on the choosemyplate.gov website and their guidelines, and really it just goes right in line with the DASH diet and American Heart Association's recommendations. But so when you look at this graphic, you'll notice that half your plate are fruits and vegetables, that there's room for grains, there's room for dairy if you tolerate dairy, and then also protein. And the heart healthy guidelines encourage balancing your calories, so enjoying your food and just eating less and really watching portion sizes. And that's really a great place to start if you're wanting to impact your overall nutrition, is to start with just watching portions and avoiding oversized portions. And foods to increase, more fruits and vegetables, getting a variety of colors, which allows antioxidants, and making at least half your grains whole grains, and switching to a lower fat dairy are all recommended. And then foods to reduce, choosing foods lower in sodium, and then watching soups and bread and different frozen meals that are already prepared that can actually be higher in calories and sodium and fat. Drinking water rather than sugary drinks is also encouraged. So, a good rule of thumb is to try to limit the amount of added sugar in our diets, and then limit the amount of processed foods, or foods that are already prepared and packaged. So going back to whole foods and limiting the amount of added sugar in our diets. Okay, so we've talked about, eating a variety of whole grains, eating more fruits and vegetables, and we want to emphasize foods containing unsaturated fat or the healthy fats, and reduce the amount of high saturated fat foods. So the healthy fats examples of that would be avocado, olive oil, nuts, seeds, where you're getting fat, but it's a healthy fat. It's monounsaturated fat or polyunsaturated fat. And examples of unhealthy fats like trans fats and saturated fats. So a trans fat, an example would be margarine as an example. Saturated fat, an example would be marbling in red meat, cream, butter. So you really want to reduce the amount of saturated and trans fats in our diet, because it can increase our LDL cholesterol or our bad cholesterol. And for a heart healthy diet, we really want to keep that LDL low. So another suggestion is to eat fish and other seafood regularly, and eating nuts, seeds, and beans as well. We're going to talk a little bit about reading food labels. And recently, the food labels have been updated so that it's a little bit easier to see the serving size, calories per serving. And you'll notice that the ingredients are listed at the very bottom. There's serving size. So this particular food label is a cookie. So there's one cookie per serving. There's 160 calories, 8 grams of fat, and that fat is broke out into the unhealthy fat. So you'll see that there's 5 grams of saturated fat. There is 75 grams of sodium, total carbohydrates about 20 grams. Okay. And it's important to understand that the ingredients are listed in order of those present in the greatest amount to the least amount. And you do want to choose food products that contain the same ingredients you would use if you made it at home. So if you don't recognize the ingredients, if there's a lot of chemicals, artificial colors and flavors and hydrogenated oils, you definitely want to avoid that product. Now, when looking at serving sizes, this graphic can help us, get an idea of a serving. For example, a small fist would give you a serving size for a potato or a piece of fruit. A piece of bread is about the size of like a CD or cassette tape, and sometimes you'll notice like the loaves of bread are more like 2 servings per piece of bread. So it's just important to understand that. And when we're talking about pasta, a serving of pasta is about the size of a tennis ball. And I'm not saying that that's all the pasta that you can have, but just to understand, if you eat a full plate of pasta, you're looking at probably like 4 servings of the pasta. Okay. And sodium. The daily value for sodium for the average adult is 2,300 milligrams or less per day. And foods with more than 15% or 360 milligrams per serving are considered high in sodium. Now, for people that have heart disease, diabetes, chronic kidney disease, the encouraged amount of sodium per day is about 1,500 milligrams, which is a little bit less than a half of a teaspoon of salt per day. And it's really easy to get 1,500 milligrams and not even pick up the salt shaker and add, just because sodium's already in foods. And so 1,500 milligrams, unless your physician says otherwise, is what's recommended. Okay, so we're going to look at 2 examples of labels here, or food choices actually. What is the better choice? So on the left is carrots. So a cup of carrots is about 45 calories. There's a little bit of carbohydrate, a little bit of sodium occurring naturally, lots of vitamin A. And let's say that you go out to a restaurant and you order sauteed carrots or sauteed vegetables. And what that does is it takes a healthy vegetable and adds calories, fat, and sodium to it. So this slide is just helps me to remember to let you know that the type of food you're choosing is important, but also how you prepare it is really important as well. So rather than getting sauteed vegetables, maybe you get grilled or steamed vegetables, and then ask the chef, please don't add sodium to my food. Okay, so just some practical suggestions when you're selecting food. Again, for any of the carbohydrate breads, rice, cereal, pasta, you want to choose whole grain whenever possible. So when you look at the food label, for example, on a loaf of bread, it should say, the first ingredient should say oats or something like that, rather than enriched white flour. So the less processed, the better. And for fruit and vegetables, fruits can be any fresh, canned, dried, frozen, as long as the label is without added sugar. And vegetables can be fresh, frozen, canned, and you just want to be sure to look for low sodium or no sodium added varieties. For dairy, choosing a lower fat dairy is still recommended. That may change in the future, but right now that's still what the recommendation is. And for meat, poultry, fish, eggs, and nuts, you want to really look for lean cuts of meat, or lean ground beef when you're at the grocery store. Try to go grass-fed if you can, or wild game as well. Chicken or turkey, always remove the skin. And fish can be fresh or frozen. You just want to make sure you know where your fish come from. Wild Alaskan salmon is a better choice And you can talk to your butcher about, different choices that they have. And then eggs, you can enjoy your eggs, you just don't want to go overboard. Eggs are a great source of nutrition. You just want to make sure that you're not having, 6 or 12 eggs in a day, but you can still enjoy your eggs with moderation. Just a few tips when you do dine out. Just understand that a small hamburger and fries at fast food is about 1,000 milligrams of sodium. So just, when you go dine out, fast food is calorically dense, or it has a lot of calories, a lot of sodium, and a lot of fat. You want to ask if you're at a sit-down restaurant, ask to have food cooked without salt if possible, and then ask for sour cream, butter, salad dressing on the side. And then just like at home, don't use a salt shaker because it probably already has quite a bit of sodium in the foods already. And then a few helpful resources. ChooseMyPlate.gov is a great resource for information, recipes. American Heart Association is fantastic. Our own Good Shepherd Nutrition Services, our dietitians are fantastic. And then here's a few apps. MyFitnessPal and FoodUcate are just two different apps that can help help you log your diet and exercise. And there are many, many, many out there. Those are just two examples. And then another resource would be the DASH diet, and DASH stands for Dietary Approaches to Stopping Hypertension. So it's for the last 8 years, research has shown that it will, if you follow the eating plan, it will reduce your blood pressure. And then also the Mediterranean diet is basically the DASH diet, but add a little bit more oil and fish to it. So those are two well-known eating plans that you can find more information on and look up. Okay? And if you have any questions about anything we talked today, or if you want to get in touch with our registered dietitians, you can always give us a call at Cardiopulmonary Rehab. Our number is 541-667-3687, or you can email me, Paula Hagel, at phagel@gshealth.org. Thank you so much. Have a good day. Bye-bye.